My name is Helga Gielen. I'm a master in archaeology. I do not have any medical background, but I'm a post-long COVID patient, and I would like to tell or share my case study. How did I get fully recovered after 3.5 years of long COVID? I had my first infection of COVID-19 during the first wave at the end of February 2020. So, what is long COVID? According to the World Health Organization, long COVID involves new symptoms, persistent symptoms lasting for more than 3 months after this initial COVID-19 infection. Indeed, from the beginning, from the spring of 2020, I had all kinds of new systems. It started with a loss of taste. Everything tasted very bitter. I had gastrointestinal symptoms. According to a test, I had mesenteric panniculitis. That means an inflammation of the fat tissue around the bowels. After 6 months, that was followed by neurological problems and PEM. PEM means post-exertional malaise. After a small exercise or an emotional happening, you get a terrible relapse of long COVID symptoms during for weeks, even months. So that was during the first year. 1 year later, after the basic vaccinations against COVID, I had terrible headaches, I had eye migraine, I had terrible nerve pain, neuropathy. And then in 22, another year later, I had a second COVID-19 infection, and then my situation became really critical. So I never had lung problems. Just to make sure, we long COVID patients, we have chosen the name long COVID because the symptoms were lasting for a very long time, and that's the reason why. And I had never lung problems itself. So more about long COVID. Everybody knows there is no validated effective treatment for long COVID today yet. And it's also very difficult to give an exact number of long COVID patients today all over the world due to underreporting and diagnostic challenges. In my country, Belgium, even today, it's very difficult to get a long COVID diagnosis. I was lucky. I got a long COVID diagnosis 2.5 years after my first infection in 2020. When my situation became very critical. But by then, I had already 10 consultants with various specialists. I had about 30 tests, for instance, 3 MRIs. But there was nothing to see on all those tests, which is very frustrating for long COVID patients. Who gets long COVID? Why? According to Professor Altman, an immunologist, okay, everybody can get long COVID after a COVID-19 infection. But today, long COVID looks like a typical autoimmune disease, and females are outnumbering men in terms of developing long COVID. There are different immune systems. Females react in a more extreme way. Now, this is very recognizable for me. I was a member of different long COVID patient organizations, and indeed, almost all the participants were female. Professor Altman also said it's important that this new disease is organized in groupings, meaningful clusters of long COVID symptoms in order to understand better what is going on in the body of a long COVID patient. Actually, I did the same during all those past years. I kept a list of all the new systems, and that list got longer and longer. And I used different colors. Problems with my bowels, that was one color. Problems in the brain, that was another color. Problems with the fascia was another color. Today, We have, according to studies, a number of clusters available. But when I look at them, for me, it was not one cluster, one of these clusters. I had a mix. I had symptoms out of each cluster. So it was really a mix. And so I started to realize that something was really wrong on a very elementary level in my body, on the level of cells, on the level of nerves, on the level of the fascia, just the connective tissue all over the body. But the problem was that is not possible to see on the classical tests. I asked for a PET scan many times, but they refused it. They did not know long COVID yet, so they were not open to give me a PET scan. Today, a strong hypothesis is viral persistence causing long COVID. So the virus reservoirs after initial infection contribute to ongoing inflammation and immune response. And I think that is a valuable hypothesis. That's exactly also the diagnosis I got. So I will explain how did I get completely cured of long COVID. The things on this slide are I already explained, but I just want to add one thing. Before my first infection at the end of February 2020, I was perfectly healthy, sporty, had no complaints, did not take any medication. I was a manager of an HRM consulting firm. So and the advice of the doctors during the first year, they did not know long COVID very well. They said nothing to see on the different tests. We cannot help you. Go home, see a psychiatrist. So slowly, the medical people started to realize long COVID is not psychosomatic. And then finally, 2.5 years after my first infection, I got this long COVID diagnosis from this pneumologist of the University Hospital of Leuven, which is the best known hospital in Belgium. 2.5 years after my first infection. And she said the high persistent antibody titer is put forward as one of the hypotheses for long COVID indeed. I also had very high level of cholesterol, new since COVID. And so her diagnosis was post-acute sequelae of COVID-19. We call it long COVID, explicit dysfunction of the autonomic nervous system, PEM. She told me you have the worst form of long COVID because of the neurological problems and because of the PEM. So it became rather a neurological immunological disorder. Here you see some blood samples with those extreme high persistent antibody titer. I had those results in October of 22 and the same in February of 23. And I only had 2 basic vaccinations in 21. So those numbers increased all the time. So during my first long COVID year, because there was no recognized treatment yet, I started a trial and error process myself. What did not help, the referring to a psychiatrist, I refused to go to a psychiatrist. I knew my symptoms were not psychosomatic. I just wanted to get rid of all those pains. Medication, yes, I tried it in the beginning because, but that became impossible. Why? Because of toxic reactions. A very small dose of a medicine caused a toxic reaction, so that was no option anymore. I tried physical rehabilitation in the beginning, but that was not possible because of the PEM relapses, PEM, post-exertional malaise. In that time, in 2020, nobody knew PEM, but later on, the World Health Organization warned for this PEM, and physical rehabilitation was no option. I did not take any booster shots after the two basic vaccinations. I got a negative advice from the university hospital because after 2.5 years, my situation became so critical. They said, the risk is too high. We do not know how your body will react on a booster shot. So what did help to become cured from long COVID? Well, I've chosen for a gentle approach to the autonomic nervous system. And this approach consisted of different trial therapies new for long COVID. It started with fascia therapy. From the beginning in 2020, I had about 50 sessions of connective tissue massage for a better blood flow to the tissues and the organs and the calming of the nervous system. I never had organ damage, lucky, but when you consider the fascia as an organ, yes, I had organ damage. The damage was in my fascia. So I also had 6 B12 injections. So they helped against hair loss, brittle nails, muscle pain. And I finally, after 2.5 years, when the situation became critical, I had a doctor, the pulmonologist from the University Hospital of Leuven, who gave me a long COVID diagnosis. She asked me, what did help you so far? I explained her soft approach of the autonomic nervous system. And so she recommended me neural therapy. Neural therapy is done by a doctor specialized in neural therapy, and the objective was a resetting of the autonomous nervous system. That worked well. After 8 sessions, I got rid of all the pains, the muscle pains, the nerve pains, the fascia pains, the bitter taste. And it's only then, when all the pains were disappeared, I could start physical rehabilitation. So I went for 6 weeks of daily swimming in a spa with thermal center in Austria. To strengthen and activate the muscles again, because I could not walk anymore. I had to use sticks to walk. And that really was a boost for my mitochondria, for the energy factories of the cells. So I did not have that low battery feeling anymore. But the only pains that remained were the pains in my fascia, around the bowels and in the brain, in the head, the places where it all started in 2020. So the final therapy was hyperbaric oxygen therapy for 2 weeks in our military hospital, and that helped. So those lost pains disappeared also. What also helped me was this understanding among fellow long COVID patients, in contrast to the disbelief in the medical world, and the refusal of booster shots. The first 2 basic vaccinations were enough for me. So a little bit more explanation about the 4 trial treatments I did. They were completely new for long COVID, but for me it worked. First of all, the fascia therapy. Instead of the physical rehabilitation that caused PEM, I had 55 sessions of fascia therapy in 2 years, the first 2 years. And it really helped me to calm down the autonomic nervous system and to deal with the stiffened connective tissue in the body. Stiffened connective tissue, stiffened fascia. Normally, the fascia is elastic, is flexible, but in a long COVID patient, it becomes stiffened by, according to recent studies, the presence of unwanted proteins causing clotting, causing the PEM. And that helped. Next, after 2.5 years, when my situation became critical, fascia therapy was not enough anymore. So I started neural therapy. And neural therapy uses injections of small amounts of local anesthetic, local on different places in the body. Anesthetic, mainly procaine or lidocaine. And the objective was to modulate and regulate the autonomic nervous system. So I have no medical background. It's difficult for me to explain, but the electric charge that keeps each cell in our body in healthy functions can be blocked or out of balance by an infection, by the COVID-19 infection. And then the chemical electric effect of procaine, lidocaine was used for the resetting to a normal electric potential of nerves and cells. Yeah, I hope it's clear. But anyway, for me, it helped 8 sessions of neural therapy during about 5 months, and all the pains disappeared definitively. So is it a solution? Will it work for all long COVID patients? That we do not know yet. Further research is needed. Those local anesthetics have a stabilizing and regulating effect on the healthy electric potentials of nerves and cells that can lead to unexpected cures of chronic conditions, provided that the organ of tissue in question has not yet been structurally affected too much, which was not the case in my case. I did not have any organ damage. Actually, this neural therapy played a key role in my recovery. So when all the pains were gone, I could start the third therapy, swimming in thermal water for the physical rehabilitation. And yes, I needed 6 weeks, and it really helped. After that, I could go back to work. I was playing tennis again, so everything was fine, unless some last pains in my tissues around the bowels and in the brain. And therefore, I did fourth therapy, also new for long COVID, which is hyperbaric oxygen therapy. That means oxygen therapy at a higher pressure. And indeed, by this therapy, those last tissue pains disappeared also. So that was 3.5 years after the first long COVID infection. And then I added another year, the past year. I did not have any relapses anymore, any long COVID symptoms anymore. So I'm considered to be completely recovered. So, excuse me, I forgot to put a slide of hyperbaric oxygen therapy, the fourth therapy. And so I'll move on to the conclusion. Given the fact that I became permanently, completely symptom-free since June 23, and I was back to exercising, playing tennis, to work, as I did before February 2020. The pulmonologist of the University Hospital of Leuven declared in October 23 that I was cured from long COVID. And the next year, I didn't have any relapses. I didn't have any long COVID symptoms anymore. So I fought for a complete healing, and I achieved it in my 4th year of long COVID, which is rather exceptional. I know many, many long COVID patients who have already for 4 years long COVID symptoms. Since then, I had 2 more COVID infections, but they were no problem anymore. I had some echoes of long COVID symptoms, but they disappeared after 1 week. So I'm convinced that my body has regained its nature ability to recover, as before the first COVID infection in February 20. So I hope this case study underlines the seriousness of this new systemic disease. And also, I hope this case might give hope to other long COVID patients with exact the same diagnosis. There are so many clusters of long COVID symptoms, there are so many varieties. But I just want to show one possible path to become completely recovered for one specific long COVID diagnosis. In general, what recommendation, what could help the other long COVID patients? First of all, get a long COVID recognition. This is very important. This is a starting point. And then a quick, correct trial treatment adapted to the specific long COVID complaints of each individual long COVID patient. So, which is a very a long way to go, I think. Anyway, one fits it all, one solution for all clusters of long COVID symptoms seems to be a utopia today. We have to do it another way. Thank you very much for your attention.